Hi, my name is Rachel. I'm going to be your nurse today. We're going to do a head-to-toe assessment. Do you know what that is?
Yes.
Okay. So are you comfortable with me touching you?
Yes.
Okay. What are your pronouns?
She, her.
What's your name that you would like to go by?
Elisa.
Okay. So I'm going to do my hand hygiene, and then I'm going to go ahead and pull the curtain, and I'm going to have your bed in the lowest position, and I'm going to have the door closed to provide privacy to you. And I'm going to start out with, let's look at your eyes. So her eyes are equal, round, and reactive. They constrict from 4 millimeters to 3 millimeters. I'm going to look at her conjunctival sac and her eyes, and they look normal. There's no redness or anything like that, no drainage. I'm going to look at your ears. Do you have any hearing problems? Do you have, so vision problems, do you use glasses?
Yes,
Okay.
glasses.
Your ears are normal bilaterally. I'm going to look up in your nose, and that looks normal as well. And open your mouth for me. And I'm going to look at the collar, and I'm going to look at the moisture. And are those your natural teeth?
Yes.
Do you have any lesions that you know of?
No.
You don't have any issues with like ulcers or anything?
No.
Okay. So her mouth was moist and pink, which is normal. And then I'm going to go on to your neurological. So your level of consciousness, she's fully conscious. Do you know where you are?
Camden Clark.
Do you know your name?
Elisa West.
Do you know what day it is today?
It's November
Do you know the day of the week?
18th? Yes, Monday.
Okay. And then, do you know why you're here?
I came in with abdominal pain.
Okay. And now I'm going to do a skin assessment. Her skin looks pink and normal. It's dry. I mean, yeah, her skin's supposed to be dry. It's pink. Do you have any bruising or any kind of injuries that you know of? And I'm going to check your skin turgor. And it is normal. It's prompt. I'm going to do your cap refill, and it's less than 3 on both sides, right? Okay. So bilaterally, it's the same. And now I'm going to do your GI assessment. And I'm going to look first. I would lift the patient's shirt, but we're not doing that for video purposes. And I would check for any like abnormalities, any change of color, any bulging, anything like that. So I'm going to go ahead and listen to all 4 quadrants for 1 minute. And the bowel sounds were normoactive. And I'm going to go ahead and palpate. I'm going to do it lightly first. Any pain? And then I'm going to do a deeper palpation. Any pain with that?
Nope.
So her abdomen is flat. It is soft. There's no pain with palpation, so that's normal. And now I'm going to do your respiratory. And I would listen under the gown, but we're not going to do that for video purposes. And I'm going to listen to all lung fields. And then I would displace the breast, but I'm also not doing that for video purposes. Okay. Now listen on the sides there. Will you lean forward? Okay. The lung sounds were equal bilaterally. There was no crackles or anything like that. They were clear. They were unlabored. Can you turn around now? I'll inspect your spine, and it's straight. It looks normal. Do you have any problems with your back at all?
Nope.
Okay. And now I'm going to check for any kind of compensation. If you have any, like abdominally, if you can see that it's
Contractions?
yeah, contractions. yeah, the use of the respiratory muscles. And so that she did not have any of that. She's not using respiratory muscles to accommodate. I would also count her respirations while I'm doing her assessment and identify any abnormal sounds. And next, I'm going to do your cardio, and we're going to do that also under the gown, and I'm going to do ache to man. And then I would also displace the breast to listen to the apical pulse. And so during this, you have S1 and S2 heart sounds, which is normal. No S3 or S4s noted. No murmurs or anything like that. I'm also going to do your pulses now. I'm going to check your carotid, and then you're going to do it bilaterally to see if they're equal. And then I'm going to do your brachial pulses, which are equal. And I'm not going to do the carotid at the same time because then you'll pass out. And I'm going to do your radial pulses, and then popliteal pulses, and then I'm going to do your pedal pulses down here. And all of that is equal and normal. Could you stand up and walk for me? That her gait is normal, and there's nothing abnormal noted. Now, I already did GI. Do you have any problems with bowel movements?
No.
When was your last bowel movement?
Yesterday.
Was it normal consistency and color?
Mhm.
Okay. Do you have any problems like constipation?
No.
Do you have any difficulty swallowing or acid reflux?
No.
Okay. And now I'm going to do your musculoskeletal assessment. So I'm going to put my hands up here. Can you shrug your shoulders for me? Squeeze my fingers. Put up your, can you push against my, yep, and do it the other way. Yep,
Oh, sorry.
okay. And do it down, good. So that's all strong and equal on strength bilaterally on both sides. Now I'm going to assess your face. I want you to raise your eyebrows for me, make a grouchy face, smile, and then frown. And that's all good, equal on both sides. Now I'm going to, as part of the musculoskeletal, I'm going to see if you have any pain with palpation for your joints. Any pain? Any pain?
No.
Okay, let me do your wrists. Any pain? No? Okay, so that's good. So everything was normal bilaterally. No significant issues. Now I'm going to do hand hygiene. Do you have any questions for me? Okay, that's good.